This is an AQA Psychology A-Level revision video for the Paper 1 topic of psychopathology with a specific focus on cognitive behaviour therapy. So to begin, let's have a look at where CBT sits in the big picture, knowing the specification and what you need to know about cognitive behavioural therapy. So you are expected to be able to describe and evaluate the cognitive approach to explaining and treating depression. So that is where Beck's negative triad and Ellis's ABC model are the explanations of depression, and therefore cognitive behaviour therapy, CBT, and challenging irrational thoughts in CBT is needed. So cognitive behaviour therapy is made up of three different words: cognitive, behaviour, and therapy. So this is an opportunity for you to pause the video, think about your knowledge of Beck and Ellis's theories of depression, and think about what the three words in CBT stand for. Jot down anything that you know about CBT. You might also have sort of wider knowledge about CBT. So jot down anything you know, and in 5 seconds we'll get started. So, CBT is the most commonly used psychological treatment for depression. It's very commonly used for other mental health problems and even some physical ailments like tinnitus of the ears. Cognitive behavioural therapy can be used to treat secondary symptoms of that, such as the anxiety or the depression around suffering with something like tinnitus. So it is a method for treating mental disorders, and it's based on both behavioural and cognitive techniques. So challenging the thoughts, changing the behaviour, which we'll explore shortly. And the therapist aims to make the client aware of the relationship between thoughts, feelings and behaviour, or thoughts, emotions and actions. CBT helps people to change the way they think, so the cognitive element, and what they do, the behavioural element. Also understanding that these emotions lie between the cognitive and the behavioural aspects. And the changes in thoughts basically make individuals feel better, address sort of some of the emotional characteristics of depression. So CBT is a talking therapy or psychotherapy, and it's a way of talking about how you think about yourself, the world and other people. So that links to Beck's and Ellis's theories of depression, how what you do affects your thoughts and feelings as well. So from the cognitive point of view, the therapy aims to deal with thinking, challenging those irrational or negative thoughts, but it also includes elements of behavioural activation, so behavioural techniques that the patient is encouraged to fulfil outside of the sessions. For example, exercise or socialising with friends or seeing family, going for a meal, going bowling, encouraging patients to engage in those activities that they've been avoiding and that they've avoided due to their withdrawal and their isolation, but actually those activities can really make them feel better. So moving on to what does CBT involve? Well, the individual will meet with a therapist for weekly or sometimes fortnightly sessions. Each session is about an hour, but it could be as short as 30 minutes. And the duration to the amount of sessions really depends on the individual. But if we go with a ballpark figure of between 5 to 20 sessions. Moving on specifically now to Beck and CBT. So Beck developed a therapy to challenge those negative triad beliefs of the client. And the idea is for the client to be able to identify their automatic negative thoughts about the world, themselves and the future. So that negative triad. Beck believed once identified, those thoughts should be challenged, which is a central component of the therapy, challenging those irrational thoughts. So let's have a look about how those thoughts can be challenged. So CBT aims to help patients test their reality of their negative beliefs. So these irrational thoughts could be challenged through homework, where the patient has to record where they enjoyed an event, because they might have this automatic irrational belief that the world is horrible and that life is terrible, but the patient becomes a scientist, so they actually note down something they enjoyed, a time they laughed or they felt really happy in themselves, and then they take that to the session with them and are encouraged to investigate the reality of those negative beliefs in the same way a scientist would. And the therapist would help them alongside this. So, your life clearly isn't bad because you really enjoyed going bowling with your friends at the weekend and you said you had a very good time, and there's your homework, there's the evidence in front of you that shows that your life isn't that bad as you're saying it, sort of thing. So the evidence is used to prove the faulty, irrational, automatic negative beliefs incorrect. Ellis and rational emotive behaviour therapy is next. So this is Ellis's ABC model, as you can see down here. It's been Ellis expanded it to ABCDE. So your D and E are to reflect disputing and challenging the irrational beliefs, and then embedding effective new beliefs to replace the irrational ones. So rational emotive behaviour therapy, developed by Ellis, is an extension of the ABC model to ABCDE, where D stands for dispute, challenging those irrational thoughts in a similar way to Beck's CBT, and then E for effect, seeing that more beneficial effect on thought and behaviour. So in REBT, the central technique is to actually identify and dispute the patient's irrational thoughts. So Ellis believes that irrational thoughts are the main cause of all types of emotional distress and behaviour disorders. So REBT is based on the premise that whenever we become upset, it's not the actual event taking place in our life that accepts us, but it's the beliefs that we hold. So it's not the breakup with our partner as the activating event. It's not necessarily that depresses us. It's the beliefs that we then become to hold on to, that no one will love us, that they must have cheated and that's why they've ended the relationship, etc. All of those sort of negative spiral of beliefs that cause individuals to become depressed and anxious. So REBT involves a vigorous argument, and that is really important that you articulate that well in an exam. The intention is to change the irrational belief and break the link between negative life events and depression. So this whole vigorous argument is the hallmark of REBT. It's the sort of thing that it's really known for. So you do have to articulate that well in an exam. REBT challenges the client to prove the statements and replace them with more reasonable, realistic statements. So because they can't prove that those negative things that they are saying is true, they are encouraged to replace them with reasonable, realistic statements through empirical disputing and logical disputing. So let's have a look at what we mean by that in a bit more detail. So Ellis identified what he saw as the most common faulty beliefs experienced by people with depression. So your empirical arguments: is your demand consistent with reality? Is that actually what's happening? And then logical arguments: does it make sense to follow that you can rate your whole self on the basis of part of yourself? So can you say that you are completely worthless just because your partner has ended a relationship? Are you basing your whole self on part of yourself or one specific scenario? And then finally, behavioural activation, which applies to both elements of CBT, whether it's CBT or REBT. Alongside those cognitive aspects, the therapist will work to encourage the patient to become more active and engage in enjoyable activities. So I gave you examples of those previously in the video. Going bowling is one that I seem to be using a lot, but going for walks, going for meals, exercising for the endorphins, etc. Because what the behavioural activation does is provide more evidence for the irrational nature of beliefs, that the world isn't terrible, or that not everybody dislikes them, or that they are not worthless, or that they're not ugly, etc. So moving on now to the evaluation of CBT. It's an opportunity for you to pause the video and have a think about some strengths and weaknesses of CBT. Don't worry if you can't think about how to elaborate on your strengths or weaknesses. That's what we are about to do in 5 seconds time. So pause the video and see what you can get written down. So we're going to start with this study by Wiles et al. The aim of Wiles et al. Was to investigate whether antidepressants or drugs alone or drugs with CBT was a better treatment for depression. So in this study, participants were randomly assigned to either antidepressants only or antidepressants alongside CBT. The improvement in their symptoms was measured through the Beck Depression Inventory, which is a questionnaire that provides a participant with a score. They have to fill it out themselves. Those with a high score indicates a higher level of depression. So the results of Wild's study was that those who had antidepressants alone were 21.6%. They had more than 50% reduction in symptoms. So about 22% of participants had reduced their symptoms by half with just the drugs. However, those who had antidepressants and CBT, 46.1% of them had more than 50% reduction in their symptoms. So that's it's more than twice as the antidepressants alone participants. And then further to that, after 12 months, those who had antidepressants and CBT continued to show greater levels of recovery, and their symptoms didn't return over that period of a year. So CBT and antidepressant medication combined is definitely more effective than antidepressants on their own, but this study also shows that CBT is effective. So there's further points here that CBT is effective in reducing the symptoms of depression and preventing relapse. There's lots of other studies, but I find Wild's a particularly useful study for you to learn. It is the most effective psychological treatment for moderate depression, is what research has found. And also it's very popular amongst the NHS and other public healthcare systems. So, it's clearly worth using. However, CBT may not work for very severe cases, because in some cases depression might be so severe that people just can't motivate themselves to engage in therapy. Even if they are taking antidepressants, they might not be able to pay attention because one of the symptoms of depression is poor concentration, or they might not want to complete the homework set. So in these cases, it's possible to treat the patient with antidepressants, and CBT can commence later, which is why the Wild study is a really good one to use. But ultimately, it is a limitation. It's a drawback of CBT because it can't be used as a sole treatment. It can't be used on its own due to those barriers. Furthermore, success of CBT might be due to the therapist-patient relationship, as demonstrated by this image down here, in that sadness is ultimately just not having someone to talk to when you really need it. Now, of course, that's sadness, but the same can be said for individuals with depression, because research has shown that actually there's not much difference between CBT and other forms of talking therapy. But the quality of the therapist-patient relationship is what makes difference to the success of the treatment. It's not necessarily the treatment itself. So CBT and other talking therapies work very similarly. So is it actually because of how CBT works, or is it just the fact that there is a therapist there and having the opportunity to talk to someone who will listen could be what matters most? Some final evaluation points for CBT is that some patients might want to explore their past. CBT is all about the here and now. What are you thinking? What are you doing right now? But actually a lot of people with mental health issues and depression, it's linked to childhood experiences. And so talking about the past might be really beneficial, and therefore being sat in a therapist and only talking about the here and now and the thoughts you are having now, those negative thoughts might actually be rooted in childhood. And so it's going to be very frustrating for certain patients, and they might choose to drop out, which limits the effectiveness of CBT. And then finally, there is an overemphasis on cognition or thoughts. There's a risk that in focusing on what's happening in the mind of the individual might actually minimise the importance of the circumstances they're living in. So someone living in poverty, or someone suffering abuse or extreme changes in their life, they need to change their circumstances. They don't just need to attend therapy. So CBT only focuses on the mind and not their environment. And those are other things that should be addressed, such as the poverty or the bereavement that they're experiencing, or something more specific, the childhood trauma that they've faced, etc. So CBT techniques can be used inappropriately, and they might demotivate people to change their situation. So a therapist has to be very tactful and mindful of that. So those are your evaluation points for cognitive behavioural therapy. Thank you for watching this video. I hope you found it useful.